What is the primary purpose of obtaining and verifying prior authorizations and pre-certifications for procedures in radiology? So option A says to ensure the patient is prepared for the procedure, and it is important that the patient's prepared for the procedure, but that's not what the purpose of the prior authorizations are. This has to do with the financial side or the insurance side to make sure that there's coverage for the procedure, because sometimes they need to see certain information in order for it to be covered, and we don't want there to be any issues for the patient. So when it says to ensure the patient's prepared for the procedure, this doesn't really encompass what the prior authorization is. So let's eliminate option A. Option B says to confirm the procedure is medically necessary. And now this gets tricky because when it says medically necessary, you might attribute that to prior authorizations because the provider sometimes needs to deem a procedure medically necessary as step 1 in order to be covered with the prior authorization for step 2. So they are related. However, the confirmation of medical necessity is done by the provider. That's not what the prior authorization does itself, but you often need that in order to get the prior authorization. So we just have to be careful with that one. But we'll eliminate it because that's not what they're looking for. Option C says to ensure that the insurance will cover the cost of the procedure, and that seems to cover what the prior authorization is. We're looking for coverage of the cost by the insurance company, and that's why we need the prior authorization in order to get that coverage. So option C looks good, but let's just see option D here, which says to schedule the procedure at a convenient time for the patient, and that wouldn't be part of the prior authorization. That would be just part of scheduling. So we can eliminate option D, and that leaves us with option C, which is the correct choice here.